virtual call today. We will have to go through some formalities, which I apologize for, but first and foremost, we'll have to go through just and state your name and address for the record, if we could, so that we know all of those people on the line today. So again, Mayor Scott Fatton, City of Fishers Mayor. We have Chris Greisel, City Attorney, is here with me as well. And we have other board member, Fire Chief Stephen Arusa on the line. Dr. Parikh, I believe I heard you were on the line, correct?
That's correct.
And I think I heard, Sal, you were on the line as well?
That's correct.
Okay. Kyle Holgren, you were on the line as well?
Yes, correct.
And then Dr. Collins, are you on the line?
Yes, I'm here.
Okay. Welcome. Thank you. So that is all of the board members. I would ask if there are any other additional people on the line. Could you please state your name?
Steve Davison, Fishers Fire Department.
Okay. Thanks, Steve. Anyone else?
Lindsay Downing, City Paralegal.
Good morning, Lindsay. Any others? All right, we will go ahead and get started. Well, first and foremost, thank you all for stepping forward and being willing participants and board members of this first health department for the City of Fishers. This is an exciting time. I want to bring you up to speed. I know you've received a number of documents and it can be a bit overwhelming. So I'm going to try to give you a high-level overview of where we've been and where we're going, and then we'll get into the business before us today. Last week was frankly a historic week for the City of Fishers. On Friday morning, the City Council took the opportunity to establish a public health department in the City of Fishers, which is allowed in second-class cities under Indiana law. They also took the action to set aside $2 million of funding that came out of our cash reserves that will be set up and established in a health fund. And so we'll talk a little bit more about the mechanics of that health fund and what that means to us long-term. But part of Indiana law under the structure is that there needs to be a board that guides the strategic vision of the health department on behalf of the community and the organization moving forward. So once that health department was established under legislative purview by the City Council, you all now, our board collectively, really guides the strategic direction of the health department and is no longer guided by the City Council. The City Council's only real function moving forward on behalf of the health department is really about, on an annual basis, appropriating the necessary funds to achieve the strategic goals set out by this board. The same is true to a large degree by my office as mayor of the City of Fishers. Although I appoint the first round of health department officials going forward, I do not appoint health officials moving forward. So the board itself is responsible for nominating and selecting additional board members. Is that correct, Chris? Oh, I'm sorry, I do. But in terms of the medical direction and the chief administrative officer for the health department, that is selected and endorsed by the board, not by myself and not by the City Council. So there is actually a fairly significant body of work and responsibility that falls upon the health department moving forward. And obviously, it would be nice to create a health department when things are slow and there's nothing going on, but that's obviously not the case here. So this will be baptism by fire. We will all learn as we go. We are really, really fortunate to have such talented people that live in Fishers and can share their insights and thoughts as we move forward. I will tell you today is very much an organizational meeting, and we can talk a little bit about strategy, but there'll be a lot more time and opportunity for those conversations down the road. First and foremost, what I thought would be nice to do, since not all of us know each other, is just to kind of say who you are, what organization do you represent, what is your medical or professional background, and then we can kind of, so we get to know each other a little bit, and I wish we could be face-to-face, but those are not the times we find ourselves in. So maybe we would start with Chief Steve Arusa. Maybe you can share a little bit about your background and why you're involved and how you will be involved moving forward.
Yep. Stephen Arusa. I moved here in 2010. I'm the chief of Fishers Fire and Emergency Services. 25 years as a paramedic, 5 years as a flight medic, 5 years as an emergency room employee, and 5 years in a phase 3 pharmaceutical research lab. The health department will be under the umbrella of the fire department, and I'm looking forward to all the great work we're going to do together.
I would brag on Chief Arusa as one of the most progressive fire and community paramedicine organizations that I've seen in the country, really trying to push the medical side of the fire service, which is not always a popular thing to do among firefighters. So we're really, really excited that, as Dr. Kaufman, who's the head of EMS for the state of Indiana, mentioned the other day, this crossroads of public health and paramedicine is really, really an exciting thing and something that we hope the public health department can focus in on as we move forward as an organization. Kyle Hultgren, a guy I've known for quite some time. He has the notoriety of being Elliot Hultgren's brother, who is the deputy mayor here in the city of Fishers. But Kyle, maybe you could share a little bit about your background.
Certainly. Thank you, Mayor. And that certainly is a tall shadow I'll never crawl out from under, but he's a wonderful person at the place I'll gladly take. So Kyle Hultgren, I'm a hospital pharmacist by training. I've been with Purdue University for the last 12 years, where I am the director of the Center for Medication Safety Advancement. It's a research center that I founded 12 years ago. And we do work really on global level population health related to safe access and use of medications, as well as all medical services. We do a lot of work in quality and safety, and really a lot around equitable allocation of medical resources. So that's been a focus of research for the last 12 years.
Awesome. We're excited to have you on board, Kyle, and I guarantee your insights and intelligence around these issues will be greatly needed. Dr. Sal, and I apologize if I get the last name incorrect. Is it Migliore?
It's Migliore, but that's why I don't even use my last name. So
okay, Dr. Sal.
Dr. Sal.
No, I just go by Sal. Hey, Chief Arusa and Chief Davison, thank you, and Mayor, thank you for inviting me to this group. I've been a Fishers resident since 2011, and I have like a bingo card of all the hospital systems I've worked with, St. Vincent's IU, and currently with the St. Vincent's neighborhood and Riverview system. And I also dabbled a little bit with EMS, and I'm looking forward to being on this committee and board member. Thank you.
Well, I know both the Steves speak very highly of you, so we're excited to have you on board. Dr. Preek, could you share a little bit about yourself?
Sure. Thank you, Mayor. As everyone has alluded to, I really do appreciate being a part of this board and playing any role I can. I completed my residency in Philadelphia and moved to Fishers in 2006, and I've been in the same job since then with Community Health Network. We currently work, I'm an ER physician at Community Hospital North, East, South, at Howard and Kokomo, and also the Heart Hospital. And again, I look forward to helping out in any way I can.
Awesome. Thank you. And Dr. Collins, can you share a little bit about yourself?
Sure. I moved to Fishers in 2002 after graduation and joined Fishers Veterinary Associates. Became an owner in 2007 and have been here and loved the city ever since. Very similar to Columbus, Ohio, where I'm from, and just honored to be a part of this team. Did have a stint before I got into graduate school as a chemist with Silicor Laboratories of Ohio. They're an international food testing lab. So that was an interesting interim before veterinary school as well.
Excellent. Well, we appreciate each and every one of you sharing some time with us today. Greisel, who will be, so our legal counsel for this health board will be our city attorney, Chris Greisel, and he will walk us through the legalities of what we need to do regarding these agenda items. So Chris, you want to start with just talking through what we're here to work through today?
Sure. So typically, if we were doing kind of an organizational meeting and we'd all be together, we would kind of go over the board bylaws and go over some conflict of interest documents, which I will provide you and kind of give you an overview of how board members within city organizations operate. And we do have some of that here today with our bylaws that have been presented. But additionally, we do have 3 other resolutions as it relates to the times that we find ourselves in. And I know the mayor will go over those here in a little bit more further detail. The first one is a document pertaining to an agreement for medical direction and supervision services. So as a second-class city that establishes a health department, part of your role as a health department or as a board of health is to appoint a health officer who primarily is going to provide medical direction and supervision for our certified and licensed employees of the department to go out and to operate under. We've been very fortunate to have a relationship with Dr. Indy Lane, working hand in hand with community health over the last few weeks and the leadership team over there. And Dr. Lane has stepped forward in that role to be our health officer. Last Friday, when the city council took action to establish the health department and to establish the funding for the health department, they also confirmed the appointment of Dr. Lane as the health officer. And so as a health board, we're going to ask you to take that reciprocal action here today. And the agreement by which Dr. Lane is going to be participating as a health officer is with Community Health Network, and that agreement's been provided to you as well. So that'll be one document. The second document that we'll go over in a little bit more detail is with Mid-American Clinical Laboratories. Mid-American Clinical Laboratories has been working with the city over the last few weeks as well to establish testing protocols for COVID-related testing. We've been very fortunate in being able to procure the rates and services that have been provided to you. As a department, we're also going to be asking that you approve the policy direction of the department, which is to pay for all COVID-related testing for eligible Fishers residents in accordance with the policies and protocols that the department's going to establish. And we'll talk about those here in a little bit. And then finally, to make sure that all this testing runs appropriately, the city health department is contemplating entering into an agreement with a company called Qualtrics, which is really the software behind all of the testing operations that we're going to be performing. You can think of Qualtrics as kind of your one-stop shop software application for signing up for testing and carrying you through the entire process all the way through the back end. So there are going to be 3 separate actions that we're going to be taking in addition to the bylaws today for your consideration, all relating to COVID or our immediate responses to the COVID pandemic.
Thank you, Chris. Before we get into each agenda item for the day, I thought Chief Arusa could potentially just share kind of a timeline of operationally where we're at and what we expect to do, particularly around testing and then business engagement. Can you share with the board, obviously we're designing this airplane while in flight, but talk a little bit about what our expected time frame is for testing as well as business engagement.
Yes, over the next, starting tomorrow, we'll experiment with the software, the online enrollment process, barcoding samples and patients. And that software challenge will go on the entire day. The following day, Wednesday morning, we'll actually do sets and repetitions with the testing staff at our site. And then in the afternoon, run city staff through it. And then Thursday morning, be ready to hit the ground running and test any residents.
And then regarding business engagement, Chief?
Yep. Our business recovery team training will be conducted on Friday. We would like to hit the ground running and hit those first businesses. We'll have the capability to establish a relationship of support and trust with those businesses starting Monday.
So pretty tight timeline, as you can imagine, but we're very encouraged. To give you guys some metrics, we announced Thursday or Friday. Thursday morning we announced it. Friday we had our council meeting. Since Friday we've had 450 residents sign up for wanting to be alerted as soon as they can possibly get a test. And then we've also had, I think it's 20 businesses so far, 25 businesses have signed up saying they are interested in being able to test their employees. The one policy difference is a business can sign up and they can get their employees tested, but they will pay the full cost of the test for that employee. And so we don't care where that employee lives. If they work in the city of Fishers and there's a business that's in Fishers, if they want to get their employees tested, they can do that through our testing site. And by using our testing site and our software, it does bring down the cost for them, but they will pay for the unit price of the test. Only Fishers residents can get the test for free. But in general, we believe that testing is a good thing, point blank, period. So the more tests that we can get done, the better, especially if there are transient populations that are moving in and out of Fishers in the workplace. So we're really, really excited about the number of people that are interested, and we feel like all of these things are starting to fall into place. Any questions on the operational side of things before we get into these agenda items? I know we're throwing a lot at you guys, which I feel bad about, but is there anything in particular that you guys have questions on?
Sal here. Question regarding the testing. I'm assuming you're going to have some demographics, but the testing, the sensitivity is not that great, and especially if you have someone who has no symptoms at all. Are you going to be able to separate those who have symptoms from those who do not have symptoms?
Chief?
Yes. Hey, Sal. Yes, Dr. Indy Lane is establishing the algorithm for the online testing and prioritizing of patients. They'll be categorized red, yellow, and green. And I can get you all the details today if you want. I can email those to you.
Oh, awesome. Thank you.
You're welcome.
Yeah, one of the good things about Qualtrics is that we'll be able to customize that front-facing interaction. So when people go onto our website and they are interested in getting a test, they will answer a series of questions, both demographic and symptoms. And based on that, they will be categorized into risk profile. And Dr. Lane is working on what our protocols will be around testing and prioritization from that. So I think we will be able to be more exact in our testing than just kind of broad brush. Other questions?
Yeah, I actually do have a question. This is Vishal Parikh. As far as the testing is concerned, what are the turnaround times for results?
Right now, according to Mackle, they're saying somewhere between 24 and 48 hours, probably closer to 48 hours, is more than likely the turnaround time.
Okay.
They're using a combination of local labs as well as they're backed up by Quest. And there's a facility in Chicago that they're taking, I believe they're doing 3 drops a day where they're going to Chicago and dropping out those tests a day from Indianapolis. And we anticipate, and maybe Chief, you correct me if I'm wrong here, right now from a volume perspective, we're looking at somewhere between 200 to 300 tests a day. It would be on the maximum side that we would be doing a day. And ours will be scheduled. So this is not a, hey, just drive up. If you want to get a test, you can get a test. They will be scheduled, I believe, is it by the hour, Chief?
Yeah, 25 an hour at least.
Yeah, so there'll be a block that you would be, and we'll try to, according to Mackle, they feel very confident that they can handle 300 tests a day and still hit that 24 to 48 hour time frame. If it goes beyond that, I think then there's questions on how long it might take. So we're going to try to stay in that time frame until that capacity increases. Other questions?
Mayor,
All right. Go ahead, Dr. Collins.
in terms of the testing, are they doing both the swab and antibody testing? Does it depend on the symptoms?
We're doing the nasal swab testing. The antibody testing, we hope will be available downstream, and public safety will have a priority for that. As you know, there's a lot of questions about whether antibody testing, whether if you have the antibodies, are they effective against COVID-19? So we're waiting for research and for the ability of the lab to accommodate blood draws.
And Dr. Collins, we did negotiate a price for antibody testing, but we're seeking medical direction from Dr. Lane on this, because as recent as I think yesterday, the World Health Organization came out and said those antibody tests don't necessarily dictate immunity or indicate
Correct.
immunity from. So we're, with the finite amount of resources that we have between our board and Dr. Lane, we just want to make sure that we're, deploying that appropriately so that we're having the maximum impact on our community. So we did negotiate a price on that, but that's not, at least at this point, we're not recommending to the board, and we're seeking direction from Dr. Lane on what the appropriate course is on antibodies.
Okay, great. Thank you.
Yep. Okay. Chris, do you want to, let's take each one of these items and maybe talk a little more in detail about each one for consideration. So the first one before you is a resolution approving the bylaws for the Board of Health. You want to talk in any detail on that?
Sure. So these bylaws, which I've provided for your review, are pretty standard bylaws in the sense that overall they provide purpose and direction for the board and the powers at which the department are going to be operating under. There's sections concerning the election of board members. So as you will all see there, for this initial appointment of board members, the term for each appointment is staggered, and then there are successive 4-year terms to be served. The bylaws cover how we're going to conduct board meetings, and those are going to be more directly applicable to when we have the opportunity to meet face-to-face. We are a public board operating under the Indiana Open Door Law, and so there are considerations for how we meet in public. And when we have the opportunities to go through more board training, I'll certainly provide you with that. There's also information relative to the powers and duties of the health officer and how Dr. Lane is going to interact with the department and provide that medical oversight and direction. In terms of officers and employees, as a board, you all have the responsibility and the duty of establishing the officers and employees of the department. Right now, we've identified one officer, a chief administrative officer, and I'll let Chief Arusa and Mayor Fadness talk a little bit more about that in detail after this. But the department, under the chief administrative officer, has the ability to hire professional employees and professional staff as the department gets ramped up. So as you've seen in a lot of these documents, the health department under Indiana law has a broad scope of authority to handle many situations regarding public health matters. Right now, we understand that we have an emphasis on focusing on COVID and our immediate response to COVID. And so the documents that are before you are all in response to that. But as this department continues to operate, there is a potential to spread the scope of what we are focusing on. And so officers and employees will certainly be a meaningful role in that. And then the final piece of the bylaws are just the general operation or the general administration of the department. And as the mayor mentioned, like all departments within the city, this department will be presenting annual budgets to our city council for approval and requests for appropriation so that with your vision, we can go out and accomplish the things that the department needs to accomplish. So a fairly basic overview, but I'm happy to answer any questions that you may have with respect to those bylaws at this time.
Great. Thank you, Chris. Any questions regarding kind of the organizational document that Chris just walked through? Seeing none, I would entertain is there a motion to approve the bylaws for the Board of Health?
I'll make a motion.
Motion by Steve, is there a second?
Second from Kyle.
Second from Kyle. All in favor, please say aye. Aye.
Aye.
Opposed, same sign. Motion passes. Next is a resolution appointing Dr. Indy Lane as health officer and an agreement with Community Health Network for medical direction and supervision services. Chief Arusa, perhaps you could talk a little bit, because this may be new to some individuals on the call, maybe not to others. Currently, our EMS division, our folks that go out, paramedicine world, they operate under medical direction today. Can you talk about what that relationship looks like and what those responsibilities are? Because they're very similar to what we're trying to set up with the health department.
Yes, all of our paramedics, our ALS providers, have a project medical director. Our project medical director is Dr. Michael Kaufman. He runs the EMS and the ER for St. Vincent's, and he is also the Indiana Department of Homeland Security medical officer. We always reach back out in the field to medical control, which would be the ER, and that ER, we function in the field under Dr. Kaufman's medical license. That's where we can do critical interventions and invasive techniques for patients. Very similar, Dr. Indy Lane will be medical direction for the health department, so we function under her authority, for example, for the COVID testing.
So one of the advantages that we see and we have by providing this type of medical direction is we're able to utilize a physician that is practicing, that is in the community and very active from a medical perspective, that can provide strategic guidance and oversight on protocols and operational issues, while still allowing the day-to-day operations to be run by the very capable staff within our organization. And so when I reached out to Brian Mills at Community Health, we had a conversation about what we were trying to attempt to do here. Brian and his team looked at their executive staff and identified Dr. Lane as an up-and-coming star within the community health ranks and someone that would have a passion around population health. Chief Arusa and Chief Davison then had a series of interviews / conversations with Dr. Lane to identify if it would be a good fit between the department and the team that they were putting together. And it's been a great conversation so far, and they're very excited to work with her. And so part of our job today as a board is to ratify that relationship that says this is now our medical direction. And by doing so, then Dr. Lane and Community Health takes on the responsibility of providing medical direction to our team moving forward. And so anything else, Chief Davison or Chief Arusa, you would want to share about that?
I'm good. Steve, do you have anything to add?
No, I'm good. I was very impressed with her credentials and her vision, so I really think she'll be a good fit.
Any questions from the board in consideration of her appointment as medical direction? Seeing none, I would entertain a motion to approve Dr. Lane as our,
Dr. Parikh, this is Chris. With your relationship with Community Health, I'm just going to ask that you abstain from this vote, and we'll consider the rest with the board. And then when we have a time to sit together, we can go through conflicts of interest in a little bit more detail.
Okay.
Thank you.
Abstention. Is there a motion to approve Dr. Lane as our medical direction?
I'll make the motion.
Motion by Chief Arusa. Is there a second?
I second that.
Second by Dr. Collins. All in favor, please say aye.
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 Unanimous with one abstention from Dr. Parikh. Thank you, Chris. Our next item is Resolution R042720B, a resolution approving an agreement with Mid-America Clinic Laboratories for certain laboratory services. Chris?
So as we've explained in a little bit of detail, we've been fortunate to work with Mid-America Clinical Laboratories to be able to provide testing necessary to support the department's vision and how we're going to be testing our residents under the protocols of Dr. Lane. For your consideration, this agreement with Mid-America Clinical Laboratories. Mid-America Clinical Laboratories is going to be providing the city of Fishers nasal swab testing at $85 a swab. They've also, Dr. Collins, to your point earlier, have provided pricing for antibodies testing should that occur, and that is similar at $85 as well. It's, I think, $78 for the test and another $7 for the venipuncture fee as well. So we're thrilled to be entering into this agreement with a highly renowned clinical laboratory here in central Indiana. So we would ask your consideration for approval of that contract. We'd also ask for your approval of consideration of the department's goal to go ahead and pay for all COVID-related testing for our eligible Fishers residents in accordance with the protocols that Dr. Lane and the department set out, utilizing the funding that's been established for you.
Thank you, Chris. I would tell you that we were getting our first responders tested at another lab, and we were paying in the ballpark of $175 per test. So we're very excited to get this number down significantly. We also understand that technology is changing literally by the day, and we'll continue to work with this lab to identify ways to bring down that cost even more and hopefully provide even a better access to testing going forward. But we do believe that this is a sound number for us to at least get off the ground with. And we look forward to working with this lab. We also are excited about the credentials, as Chris spoke to. This lab works with 22 different hospitals in Indiana today, many of which I think some of you even work with today, as well as done work for the Department of Public Health and the Department of Homeland Security. So that gives us a degree of satisfaction that we're working with a very legitimate lab in regards to this. Are there any questions regarding the consideration of Mid-America Clinical Labs for these services? Seeing none, is there a motion?
I make a motion.
The motion, is there a second?
Sal seconds.
Sal seconds. Dr. Sal seconds. All in favor, please say aye. Aye.
Aye.
Aye. Motion carries unanimously. Thank you. Our final resolution today is approving an agreement with Qualtrics LLC for health assessment software. I'll touch a little bit on this. So Chris, you fill in where you see fit. One of the things as we look to the future of this health department is really the ability to truly understand what's happening in our population. So it's not just the testing, it's the data analytics behind it that we think are so important, and our ability to engage our residents in a systemic way. To date, we haven't seen really the opportunity to do that in anything currently in the state or county's arsenal. So we went looking for the technology that would allow us to really scale this in a way that makes sense. And we were fortunate to find Qualtrics, which if you've been following at all the state of Utah has probably put one of the most aggressive testing campaigns to date as a state. And that organization, that government has used Qualtrics as the infrastructure, the backbone, if you will, of the technology to allow for all this to occur and to provide real-time data analytics and contact tracing capabilities after the fact. So we reached out to Qualtrics. We had a series of conversations, and they had a very unique interest in starting to work at the municipal level. And so we've been heads down throughout the whole weekend working on this software application. We believe that we'll be ready to go come Thursday morning. And what that means is that any resident can go onto our website, fill out the relevant information. It would then allow them to schedule. They take the test. Qualtrics will track all this with the lab. It'll be integrated with the lab. On the back end, that individual will get their personalized results. It will then provide them information as to if they were infected, what are some reference points that they can go to try to get support and help. And then on the back end, the data analytics and dashboards will be really, really meaningful for our community, partly for the idea that if we really long-term, if we start to get this testing right, we want to get to a point where residents in Fishers should be able to go on the Fishers website and literally see a real-time dashboard of what's happening in our community. To date, we haven't been able to provide any Fishers-specific information about anything going on regarding this COVID epidemic. And we really want to start to provide that information to our residents as they contemplate reentering into society in this kind of new normal. Not only that, but long-term for our public health department, we think there's a lot of applications for this software that goes well beyond COVID-19 and our ability to engage our residents and provide real-time information. So we're really, really excited about having this technological infrastructure to allow for a variety of projects through our public health department as we move forward. Anything, Chris or Chief Arusa, you want to add to that? Any additional questions from the folks on the line, any of the board members?
Yeah, this is Kyle.
Yep.
So you mentioned certainly putting up a real-time dashboard and getting information out, and certainly this can be of benefit to understand. Do you have any touch points or something set up with Dr. Lane to kind of review, or do you have any frequencies? Is it daily, weekly, about talking about specific data and how to portray that to the public so that, if something comes back or there's information that may be, so as not to induce, panic or fear or anxiety, so that way this data is portrayed in such a way that it is realistic, accurate, and hopefully giving out the correct message. Is there any kind of plan for how you're going to do that and with what frequency?
It's a great question, Kyle. Obviously, this information can be a powerful tool for good, or it can cause a degree of chaos. We wouldn't be sharing anything without Dr. Lane's express approval. And also, I think as this board works more down the road, as we get this set up, I think this board will play an integral role in kind of setting the strategic priorities and, frankly, swim lanes of the Board of Health moving forward. So I don't know, Chief or Chief Davison, either one of you want to touch on that?
Steve, do you have anything to add?
No, not at this time. I still need to review the software and take a look at it, and we'll take it from there.
Yeah, I think Kyle, you make a great point. People are going to know what are the results of all this testing, and we really got to vet what's appropriate and what isn't. I'm really excited about the internal component of this testing. We'll be able to, mitigate, prepare, prevent all types of public health issues before they rear their head publicly. So we're really excited about the opportunity to do that, especially with our follow-up community paramedicine and mobile integrated health program, following up not only on COVID-19 patients, but mental health patients, et cetera.
And I think in terms of the frequency of interaction with Dr. Lane, particularly in these early days, Chief Davison and Chief Arusa, I think you're it's either daily or every other day you guys are working directly with Dr. Lane on medical oversight. Is that fair to say?
Yes.
So it's pretty frequent, at least as we get this thing up and off the ground. Other questions regarding software? Seeing none, is there a motion to approve?
This is Kyle. I would move.
Is there a second?
Seconded by Parikh.
All those in favor, please say aye. Aye.
Aye.
Great. We have one other agenda item that we would like to add to the agenda today, and Chris can talk a little bit about this more in depth, but structurally, we have our Chief Medical Direction, which you guys have confirmed is Dr. Indy Lane, but then there's a Chief Administrative Officer that will basically run the day-to-day operations of the department, and we have selected someone that we think is tailor-made for this role, and that's our EMS Division Chief, Steve Davison. I've known Steve for over a decade, and he runs the most progressive paramedicine department in the state of Indiana, if not one in the country, having set up a mental health initiative and EDO program. Has really been pretty extraordinary and very, very competent. And so we think he's tailor-made for this role. Chief Arusa, maybe you can share a little bit about your perspective as to why Steve Davison is the right individual to be our Chief Administrative Officer for this.
Yeah, what's great about Steve Davison is he's a true visionary in EMS. He is creative and innovative. The EMS Duty Officer program is just one small example. we were one of the first fire departments in the state to have a data-driven mobile integrated health program with EMS duty officers that are on duty every day, following up with patients, no matter what their illness, and being patient navigators, so to speak, to make sure that we don't just see this patient on a 911 call. The model's being used all across the state. Dr. Kaufman his leadership was integral with Chief Davison leadership in establishing the program. So this is just another example of that. Steve, why don't you tell the board a little bit about yourself?
Well, I've been a paramedic for many, many years. I started in the 70s. I've been a paramedic for 35 years. Worked in the city of Indianapolis for 10 years. Came to Hamilton County, spent 10 years as a street paramedic and a supervisor, and then was fortunate enough to be hired in 1999 to pretty much build the paramedic program in Fishers. So since 1999, we've taken it from one truck and 3 paramedics up to we're up to about 40 paramedics and everything ALS right now. So we have a pretty robust system. As the chief talked about earlier, we have a community paramedicine program, which we initiated initially with community health, community hospitals, to look at follow-up on congestive heart failure patients to keep them from being readmitted to the hospital within that 31-day window that Medicare would assess penalties to the hospitals. So we were very successful in initiating that program. And then we moved into the mental health arena, following up on all the mental health patients in our community that have been immediately detained by law enforcement. So with that program, we touch every patient that has been immediately detained to make sure they have all the resources that they need to have a successful recovery. I really look forward to the public health arena in Fishers. We have a great community, and I think that we can really make a big difference taking the data that we get on the pre-hospital side, combining that with public health, and having some positive outcomes. Thank you.
Thanks, Steve. I can't say enough good about Chief Davison. I think he's going to do an extraordinary job at the Chief Administrative Officer role. Any questions for Chief Davison before we consider his appointment to this role? Seeing none, is there a motion?
I'll make the motion.
Motion by Chief Arusa. Is there a second?
Sal, second.
Second.
Dr. Sal, seconds. All in favor, please say aye. Aye.
Aye.
Congratulations, Steve. You just got more work.
Thank you so much. I definitely look forward to it.
Yeah. Now, under Indiana law, this board only needs to meet quarterly by state statute, but I didn't recruit and ask a lot of talented people like yourselves to come on board with this and then just, fast track a couple things and move on. I really do want to get your guys' thoughts and ideas as we build something entirely new here in the city of Fishers. And so what I would like to do, if it's not too burdensome for all of you, I would like to set up another meeting, not this week, but late next week, say like a Friday. And we have a ton of agenda items in the sense of formal approvals, because we got enough going today that we can get up and running. But by next Friday, we will have been testing for 6 days roughly. We also will have been out in the business community. I think we will have some really good lessons learned that we probably want to bounce off you guys in terms of, hey, this is what we're seeing, this is what we're doing. What are your guys' thoughts? Could we be doing this differently? And just really get your guys' take on that first 5-6 days of startup. And then starting to also have discussions more strategically about where we go from here. So we're really going to build this thing collectively together. So would it be all right if we just scheduled another call late next week for us to touch base and start talking through the initial reactions to our first action steps and then where we go from here?
Sure.
Yes.
Okay. And we'll send something out. I know your guys' calendars are crazy. We will send something out to try to get that lined up. In the interim, Chief Davison and Chief Arusa will ensure that you guys are informed with everything that we're doing. So we'll get you updates And I don't think it would be too burdensome, Chief Arusa, to provide a weekly update to the board, just saying, hey, progress made to date, here's what we're working on, here's what we're doing, so that they're well up to speed. Are you good with that, Chief Davison?
Absolutely.
And then point of contact for the department from the board. I think that's another important thing. As the board has questions, comments, either talk to Chief Arusa or Chief Davison. Either one will be available to share exactly what's going on operationally, so you guys are well aware of anything going on. There shouldn't be any surprises to any of the board members of what we're doing. I mean, we are heads down focused on getting testing stood up, and we hope to have that done this Thursday. And we're heads down trying to get our business engagement team together so we can get out there and start talking to businesses so that when the governor does open back up, we're ready to go. So again, I can't thank you enough for your willingness to do this. I would tell you that this is a lot to take in. We've been heads down on this for 3 weeks. We just dumped it all on you here today, but we're going to work together to build something that I think will truly be accretive and a value add to the city of Fishers going forward. So thank you for your time, and we'll talk to you here shortly.
Thank you.
Thank you very much.
Take care.
Bye-bye.